Thank you, Chair. This is Member Christopher Fry, new to the Standing Committee on Social Development.
Chairperson, there's no sound from the chamber. Good morning.
Testing 1, 2.
2% of the sound.
Testing 1, 2.
Shiraz.
Thank you very much, Chairperson, honourable members. Good morning. I'm Robert MacDonald. I'm the Head of Social Development in the Western Cape.
Morning, I'm Juan Smith, the CFO for the Department of Social Development.
Morning, I'm Dean Holly, Director of Finance for the department.
Morning, Chair and honourable members. I'm Zwandile, Chief Director for Community and Partnership Development. Thank you.
Good morning, Chair, honourable members. I'm Siam Niftaugreen, Director of Business Planning and Monitoring.
Thank you very much, Chairperson and honourable members. We have prepared a presentation as requested, so I will ask teams from finance and from business planning and strategy to go through it. And I think they're doing different sections each. Is that correct, colleagues? Are you doing it? See, I'm going to do it like that. So Ms. Niftaugreen is going to do the entire presentation from business planning side, and then finance are here as well to add technical detail if needed. Thanks.
Chairperson.
Okay, good morning again, members.
Chair.
Just by way of introduction, the funding of non-profit organizations represents a large part of the WCG budget, and specifically the Department of Social Development. The department is able to contribute significantly to the lives of the poor and the vulnerable in the province through this funding. And in 2021 financial year, we funded a total of 2,040 NPOs to further the policy objectives and priorities. Of these 2,040 NPOs, 192 were found to be non-compliant. Funding of NPOs is implemented in accordance with the department's policy on the funding of NPOs for the provision of social welfare and community development services. Next slide, please. By way of just a table, here's the actual expenditure for the 2021-22 financial year of all the funded NPOs per program. You will note that we funded 1.4 billion, which is a little over 1.4 billion for NPOs in our province. It's also broken down by a specific program for the members. Can go to the next slide. And then looking at the 22-23 financial year, we'll be funding approximately 1 billion. Again, for the NPOs for this coming financial year. The reduction in the funding of the NPOs is mostly as a result of the shift of ECD over to the Western Cape Education Department, as well as the reductions in budgets that have been implemented in this financial year. Next slide, please. So the department allocates this funding according to the following principles. First of all, accountability and transparency. Public funds are allocated for addressing social welfare and community development needs, and this is utilized for the intended purpose in such a manner that it can be accounted for to the public as well as all the competent statutory bodies. The second principle is that of appropriate prioritization. Funds are prioritized on the basis of the types of service, and that's based on the departmental social and demographic trends analysis and the needs assessment done by the Department of Social Development. Third principle is capacity building. Where appropriate, capacity building and support will be provided to small and emerging NPOs to render the social welfare and community development services. And that is in order to develop local capacity, especially in the non-metro and in the rural areas. Go to the next slide. Next principle, that is of efficiency and cost effectiveness. There's a focus on the results that meet the prioritized needs of the citizens, as reflected in our APPs, while making the best possible use of the resources and rewarding the projects run by these NPOs that perform very well. The other principle is that of equity. The distribution of resources is based on the needs and priorities as determined by the mandates and the medium-term objectives defined in our APP and our STAT plan. NPOs are given equitable access to bid for the funding for social welfare and community development projects we give adequate notification of funding availability through print media adverts. And then in respect of currently funded NPOs, we send out departmental circulars through a fair process of assessment and allocation of funding on the basis of these core principles. There's also the principle of professionalism and best practice. Social welfare and community development services shall be rendered in a professional manner by NGO as well as DSD staff. And then, of course, within the ethical framework and governing practices of the professional councils, such as South African Council of Social Service Professionals. And then also we conduct the funding within the legislative requirements and norms and standards as prescribed by the various statutory, the acts that are applicable to us, such as the Children's Act, the Older Persons Act, our Child Justice Act, etc. And then, of course, this is also in line with the internationally established best practices. In terms of the funding process that is followed within DSD, we look at the available budgetary resources, and we fund the provision of statutory social welfare services and approved priority social welfare and community development services. And this is to achieve the progressive realization of social service rights pertaining to children, older persons, and other vulnerable persons or members of society, as it is envisaged in our Constitution of the Republic of South Africa. The funding process is as follows. We have a funding process that takes place every 3 years. There's a notification of the intent of funding via call for proposals, and we do this via advertising in media as well as circulars. Business plans and applications are then submitted by the NGOs, and these applications set out the main cost drivers of each project or service, and these are sent in through one central point within the Department of Social Development. The business plan submissions are recorded and then submitted to the relevant program managers. Once those program managers receive those assessments, sorry, you can, next slide, please. Thank you. Once the program managers then receive those submissions, they will analyze and assess the business plans and the application forms in terms of our DSD approved eligibility criteria and the predetermined specifications. The current funded organizations are also assessed on current performance if they are already funded by us, and the new organizations are assessed on the capacity and sites visits conducted. Program managers will then compile a schedule of all NPOs that we recommend for funding, and as well as a schedule of those who are not recommended for funding. The funding schedule is then recommended by the relevant chief director and approved by our head of department. The schedule is also then noted by the Minister of Social Development. Both successful and unsuccessful NPOs are notified of the outcome of the application process. Okay, next slide, please. Thank you. The department's executive management approved the following criteria in terms of the assessment. Firstly, there must be a track record of previous or current performance. And the evidence of this track record can be obtained either via a sub-program monitoring report from the previous financial year, a comprehensive monitoring compliance assessment done with the NPO, a desktop monitoring assessment for the previous financial year, a monitoring and evaluation rapid assessment report for the previous financial year, 2 quarterly reports for the previous financial year, or an on-site monitoring and evaluation report that includes an assessment of service delivery implementation. These reports are either certified by the appropriate manager, program director, or manager, or in the case of rapid assessments and on-site monitoring and evaluation, by the monitoring officers, and they're certified as a true reflection of the status of the services delivered. It's contended that such a certified report provides evidence of a track record indicating that the NPO is competent and capable of rendering the service. Then there's also quarterly submission of progress reports before funding can be activated during the year. These reports are an indication of, firstly, sound financial information systems being in place, proper management structures and practices in place, compliance in terms of previous funding criteria, appropriate human resources practices, trained staff are available, income and expenditure of the NPO, and evidence that clients or beneficiaries have received these services. Then, of course, we also need to take care that legislative compliance is in place. Verification is done by the department that NPO Section 21 or trust registration of the residential facility or non-residential facility and or service organization is valid at the time of allocating funding. There's also verification by the relevant program that the organization or services are legally registered in terms of any other service-specific legislation, for example, the Children's Act, Older Persons Act, etc., that requires any such registration. Okay. Thank you. In terms of the methods for funding the NPOs, the following are utilized: either project or service outputs, unit cost funding method, which will, where possible, be used for the funding of residential and non-residential services. These unit costs are reviewed annually, and funding level increases may be implemented as additional funding becomes available. Unit costs apply to old age homes, CY60s, and shelters. There's also the post-funding method, which is used to determine funding allocations. Post costs are reviewed annually as well, and the funding level may also be increased as additional funding becomes available. Such funded posts include social workers and administrative staff in the NPO. Funding may also include seed funding for emerging organizations, new or pilot projects, funding for non-consumables such as furniture, equipment, and accommodation, and vehicle rental as required by a specific project or program. So currently, department's line programs monitor and assess 1,142 NPOs per annum. You will note that this is a decline from the 2,040 we mentioned earlier. In the current financial year, we are funding 1,142, and this is because of the shift of ECD over to the Western Cape Education Department. Alternatively, in a 3-year cycle, and in terms of the relevant contract, transfer payment agreements, that is entered into between the department and the NPO. The monitoring and evaluation tools that are used by our M&E officials and our social workers include desktop monitoring, which is done annually. Our on-site monitoring tool, we'll do on-site monitoring once in a 3-year cycle. Our quality assurance assessment tool, which is a 2-year cycle for NPOs who receive more than 2 million rand from us. A mentoring and evaluation tool, which also forms part of a 3-year cycle. A rapid assessment tool, which is done annually and is part of a spot check with the NPOs. There's also a financial inspection tool, where NPOs have been red flagged, and there's also an audit financial analysis tool, which is done, which is utilized annually rather. So the assessments entail the progress reports submitted by the NPOs on a quarterly basis. The verification and validation of non-financial data, for example, the register of beneficiaries that the NPO has served, targets, outcomes, and activities as prescribed by the contract, income and expenditure per quarter, audited financial statements on an annual basis, which is submitted between September and December of a particular year. Line programs also conduct site visits, and this will entail financial and governance monitoring by monitoring and reporting officials, and service delivery monitoring on norms and standards by registered social workers in accordance with the relevant legislation, such as the Children's Act, for example. We also provide capacity to building to the NPOs which are funded. If there's any non-compliance identified, the line programs will develop a service improvement plan or service delivery improvement plan for the NPOs in order to comply within a 3 to 6 month period. Follow-ups are done within the 6-month period to ensure that the service delivery improvement plans are implemented in order to improve quality of service delivered by those NPOs. If needed, further capacity building and support can be provided by the capacity building unit on issues related to finance and governance management. Then our line programs also assist NPOs with the following: registration of the NPOs, such as old age homes, inpatient treatment centers, child and youth care centers, as well as after school care centers or facilities. And this is both to funded and unfunded NPOs that we provide this additional assistance. There's also the registration of service delivery programs at CYCCs and divergent programs. Others include the accurate completion of non-financial data, progress reports and contracts. And then we also provide assistance in terms of any new NPO that applies for funding, which will be then assisted by our line programs and guided in order to comply with the legislative norms and standards. Thank you.
Sorry. I just want to check once again of the members online. I struggled earlier to make contact with you. I just heard a faint kind of a voice in the background. Members, can you hear me? Are you online with us? Audible? Let's get a check quickly.
Good morning, Chair.
Still struggling.
Chairperson.
There's nothing you can do about that, eh? It's difficult. Okay, it's fine. We try at least. They are busy sorting it out. Okay, so you will unfortunately have to talk to the two of us that is sitting down here with you. There won't be any questions from the members. I can see Wendy Philander is trying her best. Windvogel is trying. Yeah, it's a struggle. But that is the problem with electronics and communication and that sort of thing. If it is broken down, you can't do anything about it. Okay, thank you very, very much for the comprehensive report, Member Fry. I'm not so sure if you have any comment, any question. I welcome Member Baku Falls. Thank you for your presence. It's not on. Press again.
Of NGOs and also those who come from prison. What is the funding looking like for previous offenders that are reintegrated into society that come from prison? That's all for now. Thank you.
Let's take another one. Baku Falls, Member Falls, please.
Thank you, Chairperson. Chairperson, my question is on slide 8 to 9, which is since 2019, during the start of the administration, if we still remember, the ANC has been raising the need for increased funding in number of victim empowerment shelters and CMDC in 12 working class communities. I want to know, what is the department doing to support those NPOs already to do the who are in the working class communities but limited funds, and to be compliant and to receive funding from the department? Because when we were doing our own oversight, there are many NPOs that is working in the communities, but they are not getting funds from the Department of the Department of Social Development. And another thing, some of them they don't comply, but what the department is doing to assist them to comply so that they can. Thank you, Chairperson.
Can you deal with those two, Honorable HOD? You can assign the questions to any of your staff.
Thank you very much, Chairperson. I think I'll respond to the questions for now, and then my colleagues are welcome to add if they want to. So the first question about a breakdown of the different types of NGOs we fund and the names and everything, we do provide that in the annual report. My team can also provide that to the committee in writing. Obviously, it's a very long document, so we said that but we do have a full breakdown of all the different types and then the individual NGOs that are funded and how much they are funded under each category. So we can provide as much information as you need, a lot of information. The question around do we fund reintegration services for patients of psychiatric facility, Mental Health Care Act patients, as well as for offenders who've been released. At the moment, the two areas that you're mentioning actually fall in different departments. So clients who go to psychiatric institutions and mental health care services, they fall within the ambit of the Mental Health Care Act. So it's a Department of Health services. We do sometimes provide support to those clients depending on their circumstances, and if they fall within the needs of the social development space. But primarily it's the Department of Health that handles those patients, because they are permitted in terms of the Mental Health Care Act, and they are they have a doctor or psychiatrist who manages their case. So they a separate set of clients from our clients. But sometimes there's also overlap where there is for example, a drug treatment coexisting drug use or substance use disorder with the psychiatric case. Then we will assist in terms of the Prevention and Treatment of Substance Abuse Act. Usually what will happen is if a client has a psychiatric problem, they're admitted to a mental health care facility, and then after they've gone through the initial containment and support services, they would come to our rehabilitation centres, and then it would be linked to a aftercare service for drug abuse support. So it really depends on the individual client. In terms of offenders, the Department of Correctional Services has its own program, so we don't render services for former offenders. That is a service that is rendered specifically by corrections. They do have their own social workers for that. But we obviously, there are some offenders or former offenders who end up being our clients. Again, if they need substance abuse treatment or if they have other kind of needs that fall in the social development space. So we kind of work in an integrated way as far as possible with corrections as well as with any other service providers. But as I say, the correctional services does have their own social workers, and there's NGOs also working with correctional services in that space. Specifically, they specialize in that area of work. We do diversion and probation services. So that is people who are arrested but are not necessarily serious offenders, and that's where our probation officers then make recommendations to the court. So through diversion programs, there isn't, and we fund and run those programs ourselves as NGO. And we also do pre-sentencing. So there's quite a lot of overlap. Closely. A question from Michael Buckles. He's funding for GP shelters, and I think it was correct. Development in. So in terms of both, we have increased both of those significant capacity for GP shelters as of food provided, and particularly medically. In terms of GB shelter capacity, we all continued. I think the question, though, specifically about how blind at the moment. We do have an help desk that is registered as well as, so they train and support stakeholders necessary and governance duties that so that clients with it, and then also help them, guiding them on how to apply for funds, but also with not. We do have a team who does that, and they reach a number of NGOs. But I think also to bear in mind that to help the NGOs become compliant, but under all of the NGOs compliant, because we at the moment financially we had a big cut after this year. That's the cut earlier. So although client say we can guide them on how to apply. Some of them do successfully receive funding, but at the moment we have very little scope to increase funding until Treasury's finances are better. Thank you, Chair.
Bakubakufos, are you happy with that answer? Because I can understand where you're coming from. You are quite right on our oversight visit. There's always a massive outcry from NGOs, massively. They request funding, and the answer is always the department can only fund what the budget allows them to fund. And I think that is the $1 million issue. And I thank you for the manner in which you explained that. So you want to add to that?
Thank you, Chair. I just want to add a small piece to what the department said. We have a sub-program called Institutional Capacity Building, and that program helps many unfunded organizations to be compliant so that they can register and be capable of being funded by many other sources. In the training that we provide, we've got a module called the resource mobilization and fundraising. That module assists the NPOs not only to depend on government funding, to have the capacity and the capabilities to fundraise for funds from different sources. Thank you.
I would love some sort of information for our members, because we're in the firing line with the public visiting and that sort of thing. The other day I was invited to, what is the area's name? A small town called Ashton. And there in Zulani is also a kind of an old age home. And if you see what that old age home, I'm not sure if it is an old age home, but it looks like, but it was so filthy. And the walls and stuff, the roof, the gutters, dilapidated and that sort of thing. And I said to myself, but elderly can't live under those conditions. I will forward some information to the HOD about it, but if you could send a welfare worker to just to assess that also as well. But the issue there also, and I asked them the question, and the issue there also was funding. We received nothing from the department, and that is a kind of NGO. Now, I mustn't say that. All NGOs will say we need the funding after all, if you understand what I'm trying to say. But that is our biggest problem as politicians. So we face the wrath of the public with regard to that. I just want to check. Anyone online, can you hear me? Still a problem. Our technicians asked that we just pause for about 5-6 minutes because it's about 4 of our members online, or 3 of the members online. And it's a pity we can't pick them up. They also have their own set of questions and that sort of thing. The presentation is quite short. We are well within our time frame. We will save about plus minus an hour of the 3 hours. So I think it's prudent for me to say, let's pause for coffee and for tea quickly, come back. If it is that the technicians can't sort out the problem, then we just continue. Okay, and finish the meeting. Let's do that. from the department, but that is the message, unfortunately, we had to give the public out there. And but I want to urge all the members, all issues pertaining to funding, to NGOs, that sort of thing, still communicating with the department. I'm very pleased this morning to hear that there's a team in the department assisting NGOs how to become compliant. And then the HOD was of the opinion, if you're compliant, it still doesn't mean you will receive funding. We need to understand that technical issue as well. And I'm also happy with that. But I think it's better for me to say to NGOs, get your house in order, how to get funding. And but there was a missing link, and I did not make a note of it, and it's sticking in my mind. I think the HOD or the lady made the point that the department can even refer NPOs or NGOs to other institutions for possible funding. Is that correct? How does that work?
Thank you, Chairperson. Mr. Hill would like to give something for that. I think essentially it's around currently in terms of fundraising techniques and also giving information where they can approach different approaches.
That's a massive positive. If you could just explain that a little bit more for some of the members to understand.
Can you hear me?
Outside of the funding, aside from that, my colleague explained. So when we respond, we call those who are the right of the minister. We call those ministerial inquiries. When we respond to the organization, then we indicate to the if it's in the nutrition field. If it's in the social relief to or disaster response field, we'll indicate that there is an enables, and we'll list the name of the enables and the details that we may approach who can assist you. We do that with the locals and many other partners that we are aware who will be assisting.
So it means the NGOs on its own must apply to those entities.
Correct.
Thank you. That is why maybe as a major positive out of the session this morning, that information could become valuable for us. If you could empower them, the members with that information, because we standing in front of the public, we get called, like I was called to the home in Ashton, for instance, and I promised them I will bring that information, their request for assistance to the department, what I've done officially this morning. But even to say to them, you can apply here and there if you do not receive funding from the department. That is brilliant information, and we can no Monday, we can make that one of our primary recommendations out of the session this morning, that to receive that information. When we don't stand in front of the public with a mouth full of cheese. We can actually give them clear-cut information on what they can do to get funding from entities. Any other, I'm done from my side. I like all the issues. The NGOs assessed on current performance. That's important. NPOs capable of rendering the necessary services. I understand you can't just provide funding. You need to check and double check if they can render the necessary service and so on. So I'm very pleased with all of those pieces of information. Honorable Fry, are you okay? Can ladies first? Barkefors, honorable member, are you okay? I want to round off the meeting now. You may.
Thanks for the slides stating about to ask me if the department monitoring unit is adequately and what is the number of the personnel within the unit and whether they are any vacancies. And what is the number of NPOs that have been closed down since 2019 due to non-compliance? The last one, what is the efficiency of capacity building program and what are the plans to improve them? That's my last question. Thank you.
You may answer.
Thank you very much, Chairperson. Very much rejected the last question. Shot question suit that I just supplemented the last question.
Okay, my last question, to you, Chair. I was asking, what is the efficiency of the capacity building programs and what are the plans to improve them? Thank you.
Thank you.
Thank you. Thank you very much, Chair. I think I'll start with the first one, and the question on the department's monitoring of NGOs. We have each program office within the department monitors the NGOs that they fund. So we have a program office for child protection organization, the program office that funds child and youth care centres, program office for other persons, program office for disabilities, and program offices for other areas like youth development, and substance abuse, and so on. So each program office will fund organisations in their area of work, and they are responsible for monitoring those organisations. So the teams vary in size, depending on the size of the sector that they need to manage. The biggest team used to be the CDP, but then they've moved over to the Department of Education because they had 1,000 NGOs that they funded. It's about 60 people in that team. The next biggest after that is the Older Persons Program. They have several hundred child actions and service centres, so they also number of organisations to reach. So the way that you monitoring is basically they have anywhere between a 2 or 3 year schedule of going to visit the places. But also they focus on the high risk places, so sometimes they might visit the high risk places more often, places where they're closing down, places that are showing non-compliance, either with the governance requirements or with the service standards for the particular area. And so in terms of vacancy at the moment, we have vacancies in the program offices. We are in the process of funding those funds. The program offices are under the pressure at the moment. We also use the funds for posts in our budget as well. So we do have quite a number of vacancies in our program offices that we're monitoring. We also have the team from the NGO support is that sometimes will need to assist where an NGO is really battered. The NGO support team will try to help the NGO. We stop funding as a large person to try and keep the NGOs functioning. The number of NGOs closed down since 2019 due to non-compliance. We don't close NGOs down due to non-compliance, but we may stop funding NGOs due to non-compliance. So we can give information on the number of NGOs that we've stopped funding since 2019 due to non-compliance. We do have that information, but we don't see the pricing office to go back to the records of the last few years. But we don't close them. Although sometimes they do close them, stop funding because to carry on.
Just a second, to the Honourable Baku, do you want such information?
Please.
Okay, good.
The last couple of years was by order, if they are registration requirement, maybe cease operating as a substitute treatment centre, they are operating without registration, they're operating the way this finance, so with CDs, those CDs. It's not really, I mean, I think since 2019, in terms of issuing orders, probably not in organisations, CDC, where they're not registered, they're not safe. Very few. That's we can also make that information for you. Then the last question in terms of the capacity building process and I will ask Mr. Neil to speak to that in terms of the NGO capacity building.
Thank you. So, Chair, if we must grow on, I would say we're very efficient. However, there are so many individuals that are required to be in the program. Well, I'm in with Provincial. And so those will remain challenging. But as the agent has said, because so many people go to the national interview program, and which shows us it gives us real time information in terms of which NPOs irrelevantly are non-combined. And we focus on those by and large. And with the resources that we have, I think we're doing a great job. Thank you.
Thank you. That's it.
So maybe just to add as well that we our reach tools also our local offices also support NGOs with some support as well, in addition to the NGO support desk, which is based here in the CPD. So we've got the presence in most communities through the local offices. And generally they far exceed their targets in terms of the number of NGOs they assist because so many are coming forward. So it's not a good question.
Yeah, Honourable Fry, are you covered? Okay, after Honourable Fry.
Because I don't know get another opportunity, but I want to comment the department.
Okay.
Because I've been going all over our rural areas. I saw the work we were done, we asked some assistant in the rural areas, and we saw that you went there and you did whatever you afford to do.
Thank you.
Wow.
You note that. You don't want to comment on that. It's not necessary. Thank you, Honourable Baku. Honourable Fry? You are covered. Okay, I think on that note, let me use the opportunity to say to you, thank you very, very much for the presentation. Not the lengthy one, but with a lot of information. I call it the bread and butter presentation. I think you understand what I'm trying to say. Because emanating from budget cuts and things like that, you see flack from all over the shows pertaining to everybody see government as the guardian angel savior with regard to opportunities. And we can't fulfill their wishes and that sort of thing. It's a nightmare. But at the end of the day, it is very, very great to see and to note that our department is doing its best. And that is also a form of accountability from the department side and to inform us with regard to that. You understand the needs out there, but you can only go that far. Unfortunately, we as members have to understand that as well. Budgets only take you that phase. For me, it's as I've said to the HOD in the walk down here to this chamber, everything boils down to one thing, and that is money. Stroke funding, stroke budget. That's it. Have a wonderful day. Keep up. Yeah, if you want another a little snack or something like that, you can walk back to the dining room. Thank you. Was that's the wrong one?
Yes.
I think you do have the recommendations. Anyway,
I thought it was a recommendation. That one was the, okay, this one is the right one. Of what will be is our next.
check again. Yeah,
Up there,
got it.
yeah.
It's cute, you know.
Okay, that's
The
on
same
the-
one.
yeah. I want you to talk about the two, the sixth and the third. I remember this one is the one for,
Look, you forward it to me as well. It's on my,
yeah.
I'm happy with that.
Mm.
I've got no problem. Okay. Anything else we need to note this morning before we leave? I think recommendation wise, we have covered, I think the two most important recommendations is the list of NPOs.
Can I read the check? Then you can.
Yeah.
Okay, I've noted quite a few. Like the first one is breakdown of funded NGOs by DSD under each category. That is the list that the NGOs the HOD said they are going to forward to us. Then the department to provide the committee with the detailed information on how NGOs can apply for funding from other organizations if they do not get funding from the department. And the other one is the number of NGOs that the department stopped funding since 2019 due to non-compliance. And the number of NGOs closed by order, because that one due to non-registration and compliance. Those are the few that have managed to capture. I don't know if there's additional.
That is important. What is the correct English now? But it's taken up you captured the issues raised by Bafo forces. Okay, I think that's it.
So now it's only the program.
You guys have seen the program for. Where's my glasses? Let me put on my glasses quickly. My apologies.
Chairperson.
Our next meeting now.
Member Philander, Chair?
Yes, Chair.
This was ons
kan mekaar hoor, maar hulle kan nie vir ons in die chamber hoor nie.
You've seen the program.
Hulle kan
6th
ons nie
meeting
hoor
of
in die
6th of
chamber nie.
September. I'm okay with that we deal with those issues. And then the visit week to Bito, that is Plettenberg Bay, 26th to 30th of September. I've got no quarrel with that. You guys happy? Okay. And the 3rd to the 7th, that is now to, this is not Mauriceburg, it's Maritzburg.
Oh, okay. Okay, I would like to correct
I checked it last night and I read, but you know Maritzburg.
Yeah,
okay. And then Toes River and look, my big problem here is just, if you're talking about Beaufort West, Maritzburg, Toes River is on the way, and Merweville. We will have to do that in 2 days' time for those areas, and then we need to drive to Oudtshoorn and Kannaland. That is on the other side of the mountain. I'm not sure if from the 3rd to the 7th we would be able to do that. Talk to Enver and those people if the logistics will allow us to do both areas, because it's two different regions. The one is Kannaland in the Karoo, this side of the Klein Karoo. Beaufort West is the Great Karoo, but it's more towns in the Great Karoo. It's Merweville, it is Maritzburg, it is Beaufort West, and the 4th one is, where is it now? Toes River. 4 areas. We can do, because the distance to travel is, it will not allow us to do all the areas in 2 days.
Are you taking, that is why we advise that it must be a week, because for example, when we leave, it's going to be Toes River on our way.
Toes River is fine.
Yes, then when we get to Beaufort West, we can take maybe 2 days there. Let's say we leave on Monday, then we do Toes River. Tuesday is Beaufort West, the areas around.
I think there's a separate day for Canada. Even if we do that in 3 days' time, travel included and that sort of thing. Because Merweville is 90 whatever kilometers from Beaufort West. It's in the mountains, you know, Merweville. And then if you take Maritzburg from Beaufort West, that's another 70, 80 kilometers. It's on the way to the Eastern Cape. Am I right?
Yeah, you are right.
You see,
So how many, okay, so this program will start from when and end when?
we start the 3rd.
Mhm.
That date is correct, the 3rd. But talk to the other logistical people, Enver and the old man, to advise on if we will make it. We can talk.
So if they agree, then it's okay.
If they agree, then it's okay.
Okay.
All else what? Okay. Yeah.
No, he wants to take out a day or two.
No. Look, I'm looking at traveling over the mountain. What is that pass? Is it Van Rens Pass or Van Rene Pass, whatever? That is another 90 kilometers. I'm looking at the distances to travel. Cape Town is fine with 4 or 5 areas in 1 or 2 days because it's 5, 6, 7 kilometers apart from one another. But Beaufort West, it stretched out the areas we need to travel to. And that's going to take up time out of our schedule. What I'm saying is the technical guys that are traveling a lot, like Enver and what the other people, they will have to guide us with regard to if it is, we can fit in how to do it. Can we fit in Kannaland from the 3rd to the 7th? That is the trick.
Oh, Kannaland, you have a problem with Kannaland?
Because Kannaland is on the other side of the mountain.
Okay, I will check with them.
They need to say, yes, in the 4 days we can fit in Kannaland, looking at the kilometers for Beaufort West and Maritzburg and those areas. Exactly.
Okay.
Otherwise, we need to do Kannaland separately in a different time slot. But Nomonde can sort that out.
Okay, I will.
Okay, I think that is it. Nomonde, and anything else?
No, nothing from my side, Chair.
Yeah. Come, let's Baku and Fry. Come, let's have a quick bite. We can't waste the chef's time and not have. I didn't get breakfast this morning.
Mhm.
I like this a lot.
Yeah.
As long as we do what we are supposed to. We don't hide anything.
Yeah.
Chairperson,
We deal with issues.